Good morning, everyone. Thank you so much for everyone who's come to this meeting online, and also to the folk who are here with us this morning. Unfortunately, we don't find ourselves to be quorate, so we only got 4 people in this room who are on the main board, but we have a plan. So I'd like to continue anyway, and I'd ask Sarah to talk about any apologies that we may have received, please.
Thank you, Chairman. We've got apologies from several members who are unable to attend in person this morning, including Kathy Hadley and also the Director of Public Health sends his apologies. He does have a representative attending. As you're aware, we are not quorate for the meeting today, so we're going to discuss the papers, but unfortunately won't be able to make any recommendations from today's meeting, which will mean that we will need to discuss options following the meeting, but it could mean that we need to convene a very short meeting prior to the next full council of BCP on the 8th of November to ratify the decisions that need to be taken by the Health and Wellbeing Board today.
Thank you very much, Sarah. That's very helpful. I hope that those discussions will be fruitful, because we do need to get 1 or 2 of the decisions from today through and ratified before full council, as Sarah said. So could I ask you, Sarah, to talk about substitute members, please, item 2.
Thank you, Chairman. I thought it might be quite useful if everyone could please introduce themselves that have attended via Teams. So if you could just introduce yourself, that would be really helpful. Thank you.
If I just join the meeting, then I'll be able to see your photographs and I'll be able to ask. So, Dawn, would you like...
Good morning, everybody. My name's Dawn Dawson. I'm the Acting Chief Executive at Dorset Healthcare.
Thank you. Paula?
Paula Showbrook. I'm Chief Nursing Officer, Deputy Chief Exec at University Hospitals Dorset, and I'm deputising for Siobhan Harrington today.
Thank you. Simon?
Sorry, was that me? Did you say Simon?
Yeah.
Sorry.
Yes, please.
Simon Watkins, NHS Dorset.
Thank you very much. Emma?
Hi everyone, I'm Emma. I'm Partnerships Manager at Community Action Network. I'm here deputising for Karen Loftus, our Chief Exec.
Thanks, Emma. Rachel?
Good morning, Rachel Partridge, Deputy Director of Public Health at Public Health Dorset, and here representing.
Thank you, Rachel. Thank you for joining us at such short notice. Now, David, please.
Good morning, everybody. Excuse me. I'm David Freeman. I'm Chief Commissioning Officer, Dorset ICB, and here in my own capacity to be part of this, but also deputising for Patricia Miller.
Thank you very much, David. That's very helpful. Graham?
Good morning, everybody. Graham Farron, Chief Executive of BCP Council.
Thank you. And Louise?
Good morning. I'm the Manager at Healthwatch Dorset. Nice to see you all.
And you too, Louise. Thank you.
Good morning, Kat McMillan, Head of Community Engagement at BCP Council.
We have Nikki.
Good morning, Nikki Hooley, Democratic Services Officer. I'm minuting today's meeting.
Brilliant. Thanks, Nikki. You're very important. Paul.
Morning, everyone. Paul Iggulden, Public Health Consultant from Public Health Dorset team.
Welcome, Paul. Thank you. Charlotte?
Good morning, everyone. I'm Charlie or Charlotte. I'm Deputy Chief Exec at Active Dorset.
Great to see you, Charlie. Okay, and I think there's one person I haven't spoken about yet. That's Nicholas. Nick.
Hi, morning, everyone. Nick Johnson, Interim Chief Executive at Dorset County Hospital.
Thank you, Nick. Right, is there anyone else online that I haven't mentioned? No? Brilliant.
Hi, Councillor Kelly. Rupert Lloyd here, Programme Advisor at Public Health Dorset.
Rupert, my huge apologies. Thank you. Now, David Vitti in the room, please.
Morning, David Vitti, Director of Adult Social Services, BCP Council.
Good morning, Phil Hornsby, Director of Commissioning for People for BCP Council.
Thank you, Phil. And last but absolutely not least, my best colleague, Karen.
Thank you, Chair. Karen Rampton, Portfolio Holder for People and Homes, BCP Council.
Thank you, everyone. So we're quite a large group, if not not here in the room, but online. Brilliant. So now item 4, Sarah, if you could ask about that, please.
So do we have anyone attending with any declarations of interest that they need to declare this morning? So no, Chairman.
That's excellent. Good news. And Sarah, do we have any public issues, please?
No, Chairman.
Lovely. Okay, well, so we can get on with the substantive items. And the first one is going to be as listed as item 10 on your agenda. Due to time constraints for the people involved, we'd like to invite Dawn and Nick, I think, to present this paper, please, about Dorset County Hospital and the healthcare collaboration. Thank you.
Thank you, Councillor. I think if we just give a brief overview and then open it up for questions. So colleagues will be aware that across the NHS, we already collaborate very well with partner organisations to try and provide care in the most joined up and coordinated way that we can. But we know that sometimes we don't do the very best we can for people and that we could do better. And we're very keen that we always are looking at opportunities and how we might do this. So back at the beginning of the year, and itself with an acting chief executive and with a chair that was towards the end of his term of office, and the same position was in Dorset County Hospital. So there was an opportunity for us to look at potentially doing something a little bit different with the leadership and collaborating more closely with both organisations. So between sort of March and May, there was a kind of an initial piece of work just to understand if there was any appetite for that to happen within the two organisations, and an initial piece of scoping work took place. And in May, both boards decided that actually this would be something that they'd be quite interested in taking forward. And following that, there was a piece of work that kicked off really from June onwards, where the Chief Medical Officer and the Chief Nursing Officer in both organisations looked specifically at what benefits for patient care could be brought by closer collaboration between the two organisations. And they quickly identified there were sort of 4 exemplar groups, thinking about people that had long-term conditions, people that needed unplanned care, particularly the frail elderly population, people that needed more planned care, so things like musculoskeletal services, and then the wider portfolio around children and young people. And so we took the opportunity to look at the synergies between the two organisations in terms of the strategies and how closely we were aligned with our strategies, how closely aligned we were with our transformation programs, and also how closely we were aligned clinically. And there was a decision that actually there was a huge amount of alignment, and we felt that by appointing a joint chair and a joint chief executive across both organisations, that would bring us a whole range of synergies and would enable us to really drive forward some of those agenda items that are really, really important, make us more sustainable in that we would have better oversight of the way in which we could deliver care to our population, and also really enhance that collaborative working with system partners, which is something we should all aspire to do. So this doesn't preclude working with other organisations in the system. So both organisations have really good, well-established relationships with local authority partners, with the voluntary sector, and also with the other public bodies that are within Dorset. So the decision was taken in September that we would go to appoint a joint chair and a joint chief executive. So the joint chief executive role is currently being advertised. There is anticipation that the person will be put into post, or will be appointed, should I say, in December, when the joint chair recruitment will also commence. And so we'd be looking towards the middle of next year, probably by the time that this actually came into reality. So the piece of work that we're doing now is very much about developing a joint vision statement for the two organisations, beginning to think about what the operating model might look like, and also coming out for wider engagement to system partners, which is the reason that we're here today, to hear anything from you. And I'll hand over to my colleague Nick, who may want to say a little bit more from Dorset County's perspective.
Oh, excuse me. Thank you, Dawn. Really good summary of the reasons we've looked to do this. There's been an opportunity, but actually more importantly, we think it's the right thing for patients. We think it makes sense from a strategic, operational and clinical perspective. And I think, quite frankly, all of the challenges that we face, we can't do on our own. We've got to work much more closely together, and we've got to find ways of collaborating. And in my mind, this isn't a sort of a zero-sum game where if DCH and DHC work together, that we don't work with other parts of the system. Actually, this is a positive sum game. So if we can work better together, then we'll work better with the system. And I think there'll be a real positive ripple effect as well. So I don't really need to add anything more to Dawn's excellent summary, but really happy to take any questions, as Dawn says.
Thank you very much, Dawn and Nick. They're really, really helpful, and clearly partnerships are the way to go. We know that they work, and that's the way to get the most out of what you're doing, isn't it? And have the best outcomes. So thank you for that work. So do I have anyone wishing to speak on this? Yes, Graham, please.
Thank you, Chair. I think I need to make 2 or 3 comments on this, and I don't want it to be taken too negatively, but I'm going to start from a negative point of view. We have not been consulted on this. We have been informed, and I think that's really poor. So I want to make the point that actually, as a council, we should be consulted about changes across the health system. We haven't been. We've just been informed what's happening, and I think that's really disappointing. So I would want that message to go back to both boards, frankly. The second one is, if you think about the headspace of a combined chief executive, they're going to have half their time looking at the hospital issues, and that hospital serves mostly the rural population from Dorset Council, and they'll have half their headspace looking at the Dorset healthcare issues, which cross the whole area. So, and half of that's in BCP and half of it's in Dorset. So actually their headspace will be 75% covering the communities that are in rural Dorset and 25% covering the communities that are in BCP. What I'm looking for is a demonstration of how we're going to ensure that the views and the needs of the BCP population are actually being taken into account in that strategic decision-making consideration. And at the moment, I have seen nothing that plays out to that. So I think Dawn used the words, it doesn't preclude working with other organisations. Actually, I want something much more positive than that. I want to see, for our Health and Wellbeing Board, how is this combined post going to really look at the views of the BCP population, the health needs of the BCP population, and how is it going to not just take them into account, but more positively than that, convince us that the health needs of BCP are going to be as important as the needs of the rest of Dorset, given that 75% of their headspace is going to be thinking about the population of Dorset. And frankly, I'm still looking for that. I've raised it recently, but I haven't seen anything yet that makes me feel any more comforted, other than I got another newsletter saying, yeah, don't worry, we're going ahead and this is the timescale for recruitment. So I think there's a real democratic deficit and a community deficit at the moment in this model from the 2 boards that they have not taken into account in any way that is visible to me. And I think as a Health and Wellbeing Board, we should be making that point really, really strongly to those 2 boards. So I know it's going to sound pretty negative. It feels pretty negative because I'm not seeing anything coming out of it that's making me feel any better about it. But I wanted to make that point in the strongest possible terms.
Thank you very much, Graham. Would you like to come back on that, Dawn or Nick, please?
Yes, I would, please. So one of the pieces of work that we're doing is to complete an impact assessment. So this is about very much, as Graham's said, raised some concerns, to actually understand what the things are that people are concerned about, so that we can actually look at those things to make sure that we've addressed all of them. I think from a talking from a Dorset healthcare perspective, the majority of our services are actually in the east of Dorset. So, you know, we have a huge commitment to making sure that we deliver services really well across the entire county. So, as I was saying, Graham, you know, it's not that it's only we'll be looking into the west of the county. Would absolutely need to continue to deliver all of those services and develop new ways of working and better collaborations in the east. So, it's absolutely an and rather than an either or situation for me. But we are formally putting together an impact assessment that we hope will be ready in about December to actually lodge any of these concerns that people have got, so that we can make sure that we can address them and that people have got good confidence that their views are taken into account. So Graham will absolutely feed those comments into that document from us.
Thank you, Dawn. Nick, did you have anything to add?
I think Dawn's covered the main points. I think it's really important to remember that the two boards of the two organisations are staying in place with their statutory focus and statutory functions, and therefore the democratic deficit point, I think, it is an interesting one. But ultimately, the boards will be there and will continue to be accountable for delivery of the services that they are responsible for under their licence. I think the first point around the engagement, we probably could have done things differently, so we will look to rectify that going forwards. And then I think the final thing, probably just to add to Dawn's point, is that we're looking at what the kind of the operating model is for that joint chief executive at the moment. I'm not sure I entirely buy the premise around the headspace point. I think it's about the team that you have around you and the focus, and I do come back to the fact that we retain two separate boards with their focus on those two areas as well. But entirely take the points that Graham's make, and we'll make sure that we pick those up. I think it's a really important point that we capture the opportunities from this and build on those, as well as looking to mitigate the risks, and that's what we'll look to do.
Thank you, Nick. I know you're waiting, Simon. I've got Karen Rampton next, please.
Yes, thank you, Chair. I do think that Graham makes some really valid points with what he said, and I feel that there should be some sort of formal marker that we as a board are not particularly happy with how it's been done. So I'd like to propose that we have written representation from yourself, Chair, if you're willing to do that, to add to the assessments and the work that's ongoing.
Thank you, Councillor Rampton. I think that's a really good suggestion, and perhaps we can make that happen. Yeah, we can write a letter. Thank you, Sarah. Yeah, actually, I should have done this right at the beginning, but to introduce Sarah as well, who's new to this board, and we thank her for all her work to get the arrangements together. Thank you. So, Simon, you're next, please.
Thank you. Yeah, I mean, I think, I don't say I would express concerns, but when you've got a community provider who's covering the whole of Dorset and an acute trust who's essentially covering the west of the county, there are going to be some interesting interaction, shall we say, between them, primary care, but also UHD over in the east of the county, I would have thought. So I'm not sort of trying to be negative here. I'm just interested how that's going to work out for the future. Be quite interested to hear UHD's opinion really on how they feel they would interact with, because there are inevitably, and history tells us, there will inevitably be some conflicts at some point in the future. And I'm sort of struggling to see how you can iron those out and square that circle with because you essentially be coming from almost completely different points of view with certain situations.
Thank you, Simon. Paula, did you want to answer that one, or
certainly be very happy to do that. This was discussed at the chief exec meetings and also chief executive and chair meetings. I think we felt that the feedback from UHD has been listened to by Nick and Dawn and colleagues, and it really was a similar thoughts in terms of the balance between the east and the west of the county, and we've heard the feedback from Dawn and Nick regarding the plans. UHD board isn't standing in the way of any of these developments, and we're committed to working together to make this work if this is the outcome from the review. But we're very aware that there was further work to do in terms of the impact assessment, and certainly Dawn has outlined that to us. So I think it would be fair to say, you know, there were concerns raised regarding the balance of the population and how we've managed that, but an absolute commitment to work with boards to make this function on behalf of our population.
Thank you, Paula. David Freeman, would you like to say something, please?
Yes, thank you. Excuse me. I thought it'd be helpful to give an integrated care board perspective on this as well. So a couple of things. One, just to acknowledge, Graham, your challenge around the engagement to it. And I think Nick and Dawn have kind of taken that on board. I think, you know, in the rush to try and seek the improvements, you know, it's moving at pace. And then when you do that and try and get things moving, there are missteps. And I think we can recover some of that. But just to sort of draw in our focus to some of the potential benefits here, excuse me, one of the things I would say is that the very creation of the statutory footing anyway, the integrated care system and the integrated care board makes this a better proposition than might otherwise have been, because the organisations coming together insofar as the shared chair and chief exec will be doing that through a system lens, and the requirement on us all to keep working in a system way will ensure a degree of balance across the changes that start to take place. But the other thing to say is, you know, I've been in the NHS a long time, and I've worked in many systems that don't have integrated provider models, and a couple of systems where I have, and they've been complex geography systems as well. And I have to say, it works much, much better when you combine acute and community services through opportunities like this. The read across, the learning, the synergies, the smoothness of working that comes out of these sorts of changes is a massive benefit to the population. So I think in the context of our new ways of working and our new approach to how we co-design for our populations and delivering at community level, and you will see from a paper later on this agenda the importance of working with our neighbourhoods and communities. Whilst these changes take place structurally, I think in delivery and operational terms, there is a massive benefit to be gained for the BCP population from this. I think it's right and proper that we check and challenge and assure ourselves that we're well within the focus of these changes, but I wouldn't want us to lose sight of the potential benefits because of the way that this news has arisen at pace for members here. So if I could just add my encouragement and endorsement to that side of it, and we'll make up for some of the engagement work as Dawn's outlined through the impact assessment, that'd be great. Thank you.
Thank you, David. Paula, is that an old hand, or would you like to speak again, please? Right, thank you. Graham, you'd like to come back in?
Yeah, so I suppose it's just really to say that I hear the words, we've got to see something more than that in terms of some really open discussions, because, you know, I first raised this a few weeks ago. We have still not been involved in we've not been engaged at all in this process. All we are getting is another email saying this is what's happening. So I just think that the approach has to change. And I hear people saying we're going to learn from this and we're going to change, but I've not seen anything. And I think this Health and Wellbeing Board needs to see something coming out of that. You know, not just hearing the words, because yeah, we all learn it's being done at pace, but actually it's not being done at that pace that couldn't have engaged with the Health and Wellbeing Board here.
Thank you, Graham. That's really good to hear. Dawn, would you like to come back, please?
Yes, absolutely. So I was just going to suggest that perhaps, Graham, I looked at what might be most beneficial for Bournemouth, Christchurch and Poole that would actually be helpful for us to come and have the discussions. Graham, I know we spoke and you invited Nick and I to come to this meeting as part of that engagement piece, but I'm really happy to work with you and your office to, you know, maybe set up some different events if that would be most helpful for people.
Yeah, thanks.
Thank you, Dawn. So if there's no more comments, I think it seems to me that a lot of views have been expressed. It's been a really useful conversation, and probably more conversations to come on this so that we can really all feel involved and collaborative. with. The impact assessment will be really helpful, and perhaps others can feed into that as well, so that we can make sure that, that everybody's inclusive. So with that, I don't think we have a recommendation from that. No, so thank you so much for making time from your day in London, both of you, and have a good day. Thank you. Bye-bye.
Thank you very much, Councillor. Bye-bye.
Bye-bye. So,
Thanks.
okay, thank you, Nick. So now we move on to item 6, going back to the proper order of the agenda, which is about the Better Care Fund. And I think, Phil, you're going to present this. Thank you.
Thank you, Chair. This is a report that some people on this board will have seen previously in other iterations in previous years, but this is the Better Care Fund report and submission for the current financial year. It might seem late in the year, but then the guidance didn't come out until July with a submission date of September. So we've submitted a draft plan to NHS England, and this is the, it has to be signed off by the Health and Wellbeing Board. So this was the first opportunity to come in front of the board. So the document, the covering report really sets out the broad terms around what the Better Care Fund is around and how we've had to approach the submission this year. But there are other documents. There's 3 separate documents attached. A narrative plan which really sets out in some detail the different schemes and the approaches to those schemes which will enable people to maintain their independence, support early hospital discharge, links around carers, and other elements such as the integrated community equipment service. So some detail, but actually the overarching message is that this plan isn't significantly different than the one from last year because the planning conditions did not change. There was one additional element, which was a capacity and demand submission, which doesn't form part of the assurance process. But it's really trying to say what is the capacity required, the expected demand over the remainder of the year, so that we can be measured about how we met that demand. I just wanted to draw members' attention to a couple of areas. This Better Care Fund is a pooling of resources. There's a minimum requirement for NHS Dorset to uplift the previous year's contribution, which they have done, and then there's a supporting contribution from BCP Council, which is set out in the paper. We have to agree this plan jointly, and as part of the sign-off process, the Chief Executives of BCP Council, NHS Dorset, have signed this off, as well as the Director of Adult Social Services, and that has gone through and everyone's had a good look at this and feels comfortable with it. Within the document, we set out the scheme descriptions in broader terms, but you'll see that the overall pooled fund is £64 million. So it's not an insignificant number. And that is, it's one of the key delivery vehicles, Better Care Fund, to support a move towards integrated services. And David and I, David Vitti and David Freeman and I, along with colleagues in Dorset Council, have been talking about how we move closer together, both from a commissioning perspective, but also the services that can be integrated over a period of the coming years. So the other message I wanted to give is that we will be reviewing the schemes within Better Care Fund over the remaining months of this year in advance of any new planning conditions that come along for 23-24, but with a view to say, are these still the right schemes? What might we need to change? How will that support integration for the future? I didn't particularly want to say any more, Chair. Hopefully, any questions relating to the detail within documents I can answer. Thank you.
Thank you very much, Phil. Yes, quite a long paper with several appendices. So, are there any comments or questions about this? I don't see any. Everyone's happy that we continue with this as it is. Thank you very much for everyone who's put work into it, and it's really good to see that that fund continuing, you know, as a collaboration. So that's great. Oh, sorry, Phil.
Chair, it's different. Bad omission by me. We've already had response back from NHS England on the first stage of the assurance process. So apart from some minor tweaks which were incorporated into the paper before you today, they are confident and comfortable with in terms of assurance of our plan. So I'd expect once we've formally submitted it, we will get sign off by NHS England fairly promptly.
That's really good to hear. Thank you. So do we need to vote this through, or it's just we do?
It is a recommendation for the board to sign off, and it's a condition of the requirements. So we will need to find a way to do that.
Thank you. So can I have assent from those in the room that we approve this now, and we are minded to approve it at a further meeting when we can ratify, when we can have a quorum, a number of people. So everyone in favour? Yeah, good. Thank you very much. That's carried as a view. Thank you. So now we can move on to the next paper, number 7, which is a movement for movement. And I think this is a continuation of the paper that we had at our last meeting from Active Dorset and another organisation, and the Dorset Health and Wellbeing. No, sorry. Anyway, Active Dorset, I know, are on it. So please, Rupert and Charlie, talk about this. Thank you.
Thank you, Chair, and thank you to the board for the opportunity to come and speak to you again this morning. We've got a very short slide deck, which I will just bring up on screen, if that's okay, please, Chair. So bear with me for a moment. It's just taking a second to load, but hopefully it will appear in a minute. There we go. Can you see that okay, Chair?
Yes, I can. Thank you.
Lovely, thanks, and I can see some nods. That's very helpful. So yeah, I'm Rupert Lloyd. I am part of the team at Public Health Dorset, and I'm here with Charlie Coward, who is Deputy Chief Executive at Active Dorset. And hopefully board members have had the opportunity to read the paper and also take a look at the appendix, which is the draft strategy, A Movement for Movement, which the paper refers to. This very short slide deck is just to serve as a reminder of some of the key kind of points within the report, and also pick out our recommendations or request of the board this morning. So with that in mind, A Movement for Movement, the draft strategy sets out our shared approach for enabling all of us to move more across BCP and Dorset. And as we outlined to the board when we spoke back in June, the strategy and the themes and the challenges it outlines have been developed from engagement that took place largely online during 2021-2022. It builds on what we found that we already do well across BCP and Dorset, but recognises that we still have a challenge, as outlined in the report, in terms of the number of people across our population who could benefit from moving more, being more active, and also outlines what that challenge looks like in terms of an opportunity to do more as a board and as a group of organisations to enable more people to move more in daily life. And it also sets out some key themes for how we can make change and how we can apply them to our own decision making as individuals, as services, as teams, and also as organisations and an ICS. So those challenges, I think, will be familiar from the strategy, the paper, and from our previous presentation, but we've condensed them into, I guess, 4 key headlines. What is it that gets in the way of us moving more as a population. So we reference in the strategy that other pressures and priorities outweigh the value we attach to movement. Not moving more is a norm that we learn from and have reinforced by others, by our family, social networks, peers at work and others. And the places that we live in can make moving challenging and sedentary behaviour convenient. So very much thinking about the built environments, our homes, our workplaces and so on. And then finally, physical and mental health limits individuals and organisations' capacity for moving more and enabling others to move more. And I think the kind of key point to take from that is we're thinking about issues like, for example, feeling of fear or concern about what level of movement might be safe for people with long-term health conditions, and also obviously the other pressures that we all know about, which limit organisational both capacity and I guess bandwidth as well, for focusing on what we can do beyond the day job to make moving more part of our decision making and day-to-day business. Those three kind of three themes that we can all do to make a difference, again, should be familiar from last time, but to recap, we need to reframe the language we use when we talk about physical activity. So this is about making that shift in our language, all of us making that shift in our language away from sport or formal exercise when we talk about physical activity, and talking about movement in whatever guise works for individuals, and building on that, needing to build movement into everyday life. So finding opportunities for us all to move more, which aren't just in, those specific windows when we exercise or go to a place to exercise, but thinking about what movement looks like at work, at home, for our workforces as part of their day-to-day business. And then finally, thinking about value and motivation, and that sort of underlying theme that what motivates one person to move more might not work for others. We need to connect everyone with the value of daily movement. So our recommendations or our request to the board today, we've got three. So please note the key challenges and themes for action that we've set out in the report. And we would like to request the board's approval or sign off, whichever is more appropriate for the draft strategy. I'd emphasise draft just because I think there are still a few relatively minor tweaks that we need to make, but we would like to ask if the board is happy with the substance of it. And then thinking about where we go next, we would like to request that the board lends your support as we launch a movement for movement during autumn of this year, and also engage with the approach it sets out. So work with us to start to think about and unpack what some of those key themes for action could look like for your organisation. And with that in mind, those kind of next steps that we would like to suggest is number one, I've already alluded to, how can we support you? And when I say we as Active Dorset and as Public Health Dorset, to unpack what a movement might mean for your organisation. So an example of that, which is already in train, is BCP Council's Active Lives Statement, which is under development and very much, I think, reflects some of those themes in the strategy and starts to bridge across into other areas of BCP's work, like, for example, potentially the local plan, green space management, active travel delivery, and so on. How can we support partners to share, collaborate, and support each other as we start to unpack that strategy? And finally, a suggestion or a request, perhaps, can we as a board commit to coming back together, reconvening in 12 months' time to share what action looks like, what action we've taken as organisations in 12 months' time? And I think that's my final slide, unless Charlie wants to add anything to that.
No, I don't think so. Thanks, Rupert. Well summarised.
Thanks, Charlie. And thanks, Chair. I will stop sharing.
I think we're happy to take any questions or comments at this point, if anyone's got any.
Thank you so much, Rupert and Charlie, for the work you've put into this. I do think it's a really important document, and it's something that we need to try and get our population to own and understand and take on board, because movement is so very important. I think the circle on page 68 about the health benefits of physical activity is very impactful, and something that we could perhaps use, to spread widely, because that sort of direct discussion on this is what might happen if you don't move a bit more, might well have some effect. So thank you very much for that. So I'd like to take any, do I have any questions or comments from anyone else? Not at the moment. Oh, Karen, thank you.
Yes, thank you. It's a really interesting strategy. It's obviously it's not meant for the man in the street, is it? So I've just wondered what was going to be, how we're going to get that message across to people. There's a lot of really good information in here. How do we pick out the bits that are relevant to somebody? I love the message that every minute counts, and that to me would be a really key message to get out there. But I'm just wondering how we do that. And if Graham Farrant is still on the call, I just want to remind him about the table tennis table he promised me for the BCP Civic Centre. Thank you.
Thank you, Karen. I was going to mention the table tennis table myself, so I'm glad you brought it up. I'm not sure why I missed it here. No. Oh, he's gone. Oh, we'll make sure the message gets through. Rachel, please. Thank you.
I just wanted to say thank you very much for the presentation this morning. Really good, and it feels like it's moved the presentation and the session we had at the previous Health and Wellbeing Board. So it's really great to see that development. I think the strategy looks really good and coherent, and I'm sure if Sam were here, he would be absolutely keen and talking about the role that physical activity plays in our system-wide approach to encouraging physical activity and the health benefits that come from that, and weaving that into the integrated care partnership strategy, for example. And it was just kind of in the spirit of keen for this piece of work was sponsored by the Health and Wellbeing Boards, and you've done a great job engaging with us all to create this strategy for us to hang our work on. But I'm really conscious that it's a system-wide strategy, so it's for all of us around the board, and taking back to our organisations to kind of now put meat on the bones. It's given really powerful insights around some of the barriers and opportunities and the evidence base for us in Dorset and BCP, but it's how do we make this real, and how do we as organisations commit to this and be, in the nicest possible way, held to account, because it is all of our document. It's not just for you, Charlie and Rupert, although I very much appreciated that you've given this presentation for us. So it's just a bit of an opportunity to get that discussion going about how we can articulate this as it being our Dorset strategy.
Thank you, Rachel. Yes, I think, and it also goes back to what Karen said about getting this out to the man in the street, and so that everybody hears part of it that affects them. So do I have anyone else wanting to speak? No, I don't think so. The answer, yeah. Oh, yes. So, yeah, Rupert or Charlie, would you like to talk about how you intend to get it out there to everyone, please?
Will I offer some thoughts first, Charlie?
Yeah.
And I think, thank you, Councillor Rampton. That's a really helpful question. I think something that you'll have noticed from the strategy is we haven't delved too much into being prescriptive about what individual organisations should do, partly because we're aware that there's already a great deal of activity going on across those themes, but also because we would like to support and work with organisations where we can to understand what more they could do. A obvious point, and again, it's I guess a request to the board, thinking about the person on the street. Person on the street is going to be, in many cases, part of the workforce for our organisations. So if any board members are happy to help us articulate what this means, what the strategy means, and how they build movement into their daily life or your daily life, that would be really appreciated. And what I mean by that is a short video, a blog, whatever works best for board members and their organisations. I think that would be a plea from me. I don't know if you've got anything to add, Charlie.
Yeah, I think you're right, Rupert. It is meant in that places can decide what works for them, in that it's not a set delivery plan within the strategy, which you'll have noticed. But I think in terms of residents and our population, hopefully they'll see that through the work that both local authorities do and our ICS in terms of how their places are designed, the places where they live, their environments, what we encourage in terms of lifestyle, how easy it is for them to move in day-to-day life, and in thinking about our health system, how that encourages people to take responsibility for their own health and well-being, the role that physical activity has in treatment, management, prevention of long-term conditions, and us advocating for that, and all of our services speaking about it. And I think that's the cultural bit. Everyone in the room is in charge of making decisions and talking about what they do to move more. The more we talk about it, the more important and natural it becomes to others, and that's what this is about. It's a cultural shift. So we'd love, in terms of, there is a comms element to it clearly, and we've highlighted some work that we want to do that already around changing language. So both local authorities will be putting messages out there to the population. How can tweak the language from physical activity and sport to movement, everyday movement, encouraging walking and cycling as part of travel to school, work. So it's all of the sum of the small parts, I think, which hopefully will increase the physical activity levels of our population.
Okay, thank you, both of you, for those ideas. I think you mentioned about coming back in 12 months. I think we'd like to see this again, please, and to see what progress has been made and whether you can evidence, that those projects have got out into the wider population through different sports clubs, and other organisations, third sector people. They're really good at getting to the local communities and impressing these, these lifestyle changes onto them. Live Well Dorset as well, they do quite a good job with that. So there's a lot of people out there already doing it, but I think being guided by this new strategy would be helpful for them. So we might have to make sure that as many people as possible know about it and understand it and are able to implement it. So great, we'll put you on the forward plan for a year's time, if that's all right with the board. Okay, thank you. So moving forward, we have recommendations, as Rupert's mentioned, noting the contents of the draft physical activity and movement for movement, and approving the draft strategy and supporting the launch and dissemination of a movement for movement within our organisation during this season, and engaging with the approach it sets out. So is everyone present happy with that? We can, so we say yes, we're happy to give that view, that we agree, and we will ratify that at our next little meeting, I think. So thank you, everyone. We're now moving on to item 8, which is a very important update on the role of the health and wellbeing boards in the integrated care system. So I think Bill, David, no? Who's going to be presenting? Sorry, Rachel. Rachel, thank you, Rachel.
Hello, thank you. This was a paper that was pulled together by Sam, and it was very much an update on the work that we've done over the summer, and I mean we collectively. So at the last Health and Wellbeing Board, we talked about the development of the integrated care system. And over the summer, we had a joint workshop facilitated by the LGA Deputy Chief Exec, Sarah Pickup, who came to give a presentation the day before the guidance was released. But luckily, she was very well informed, so gave very good links to the changing and the guidance that was coming out around the integrated care system development, the development of the boards, and also the role of health and wellbeing boards going forward. So this paper is very much just setting out a reminder of the work that we did in the summer, and there were some really great discussions to reflect where there are opportunities for the Health and Wellbeing Board and how it could be best articulated for us in the Dorset system and the two BCP and Dorset places within that, about how we can make it work so it's really effective for us to really have a good system of engagement and avoid duplication and potential confusion as the new infrastructure and architecture develops. So there was a real sense of commitment from all those, and many of you attended and gave your time and input to that workshop to really reflect on what would work best for our local system. And we got a strong sense of the appetite for the Health and Wellbeing Boards to be those recognised as the two formal places. So this paper, and it's probably one of the papers, Sarah, that we need to make sure is agreed in a timely fashion, is to recommend that the two Health and Wellbeing Boards are formally recognised and take on the responsibility as those places within the integrated care system in Dorset. And the reason that there's a time sensitivity to do that is that in order to be able to do that, the boards need to make that recommendation and take it to the two councils for agreement to a change of the terms of reference. As I said, it was a joint workshop with representatives from both Health and Wellbeing Boards, and there was alignment in the agreement that both Dorset and BCP in that meeting felt that this was a sensible approach, and it means we can build on the strengths of the Health and Wellbeing Boards and their role that they've already been fulfilling, but strengthen it and make it clear. I hope that's a fair summary of a brief paper. So the key recommendation is that we, as the BCP Health and Wellbeing Board, recommend that we change our terms of reference to identify ourselves or to add it to the terms of reference.
Thank you, Rachel. That's fine. Yes, and I think you have described it very well. It's the whole new situation with the ICP, the ICB, and the ICS is quite complex, and we're all just beginning to, get under the skin of it and understand exactly where we are with each of the different areas. But being our Health and Wellbeing Board, being the strategic board for the place-based partnership for BCP council area, I think that's really important, and Dorset have already heard this at their Health and Wellbeing Board, and they're about to, or they have taken it through their council process. So I think it behoves us definitely to do the same, so that we are on that same playing field and part of the new system. So I'd like to ask anyone if they have any questions or comments on this. Not at the moment, no. Okay, then it is an important decision. We can agree it here today, but only insofar that we have to ratify it later when we are quorate. So I'll just read through. Rachel has summarised it actually, but I'll just read through that we are asked to recommend to full council an addition to the terms of reference of the Health and Wellbeing Board, so that it becomes a strategic board for the place-based partnership developing in the BCP council area as part of the Dorset integrated care system. So is everyone here happy that we take that forward to the next meeting? Yes, thank you very much. So could you record that, please? Thank you very much, everyone. It's a shame that we couldn't do it in entirety, but we will do before the council meeting, I'm sure, Rachel, so that we can take that through. So we now have item 9 on the agenda, which is the Safeguarding Adults Board annual report, please. And I think David's going to present this. Thank you.
Thank you, Chair. Sian Walker McAllister is the independent chair of the Adult Safeguarding Board, but regrets that she's not able to join us today. So she's asked me to make a few comments on her behalf. The first of which is that this is a very interesting annual report, because it's the first time that we've presented a combined report on behalf of what was the Dorset Council Board and the BCP Board. Previously, the two adult safeguarding boards have shared the same independent chair and in fact shared the same subgroups. But this is the first year and since April of this year that the two boards have come together. So this is now a single annual report covering both BCP and Dorset Council areas. The board is responsible in part to seek assurance from all partners that we are collectively safeguarding people with care and support needs. And so part of the purpose of this annual report is to present to the Health and Wellbeing Board that the board is in fact doing those things. What you will see, I think on page 5, are some of the achievements that the board has undertaken in 2021-22. And then on page 6, a look forward to the strategic themes that the board will be picking up or is picking up this year. Amongst those, I think, are some really important issues. Young people in transition, young people with care and support needs in transition from children's services to adult services. How the Safeguarding Board fits in with and works with the ICS. Homelessness as well is a key theme for this year, and so is engagement with communities. And in fact, to support better engagement with our communities and with our residents, the Safeguarding Board has set up a subgroup, which I think has met 3 times already, and that's specifically engaging with residents across BCP and Dorset Council. You'll notice as well, looking at the report, because it is looking backwards, there's a strong focus on the impact of COVID in terms of how people have faced harm and have been protected from harm, and the challenges for the statutory partners in responding to COVID and safeguarding. And it's also recognised in some of the data that's presented that neglect, self-neglect and omission has, again, because this is not the first time, been the prominent form of harm that people with care and support needs have faced. And then the latter part of the report is divided into sections from all of the partners, which summarise the actions and achievements that they've made in 2021-22. That's probably all I wanted to say on behalf of Sian, but happy to take any questions, Chair.
Thank you very much, David. That's really helpful. Yes, really good report. Lots of pictures, you know, charts, that sort of thing. Really helpful, rather than a whole lot of prose, really. So that's really good. Thank you. So, do I have any questions from anyone? I can't see anyone online. Anyone here? No. So please convey our thanks to Sian for producing this and for your work in it as well. Really, thank you very much. And I don't see anything. Is it just for noting and passing on?
Thank you, Chair. Yes, it's a report that has to be presented to the Health and Wellbeing Board every year. So thank you for your attention.
Thank you very much. Yes. So I think apart from that, we have the forward plan on here on our agenda. And I have noticed that one of the items for looking at forward meeting dates will be the Vibrant Communities Partnership Board. And I would like to suggest to the board that we actually have a report from this board every time, because we had a meeting this week and it was so positive, so full of all of the work done by different members of both third sector partners and also our communities team on making sure that our local communities are adequately looked after and helped as far as we possibly can with the winter resilience problems that are coming our way. So I would like that to come to the board every time, because the Access to Food Partnership, which is also mentioned, is actually part of that private communities work. So I think we can roll that into one. And we've also got changes to hospital roles of hospitals I don't know whether should we leave that on the future items on the forward plan and incorporate into the next scheduled meeting rather than our emergency one. Yep, thank you very much. So does anyone else online have any comments about the forward plan or things that we might like to put on? No? Okay, so thank you all so much for coming. We're going to have a quick conversation about a date for our head of Sarah then, please.
Yeah, I think we might have to email around and find a suitable date so that we can ratify any decisions which need to be taken forward.
Yeah. The most important one of which is about the place-based partnership, obviously. So that will have to be done in the next 2 or 3 weeks to be before the next full council. So Sarah will be in touch with those people who are substantive members of the board to make sure that we can be quorate on that date. It won't be very long, but you will need to be here, please. So with that, thanks again to everyone and have a lovely day.